as much as I love genetics, I'm a medical geneticist, I think about this all the time. It's not just about your genetics, though. It's a really key part of the story. But in addition to that, the way you live your life, style choices, your environment, the food you eat, the exercise you do, the things like that we know impact our health, that influences your healthcare trajectory. And what we're getting better at is putting that information together and synthesizing it so that I can tell you what a trajectory looks like for you, but also can tell you what improvements you may want to make in your lifestyle, in the choices that you're making every day to impact that trajectory.
New choices, new players, new models of care. You know consumer first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go. Welcome back to the leading podcast about consumer-centered healthcare. This is episode 367. I'm Jared Johnson, and here's what's going to go down today. We have the flavor of the week about the changing dynamics between physicians and patients. How should we process new research from YouGov about doctor-patient relationships, and how can those insights inform the way that we design and build consumer experiences? I'll talk about that. Then I share my exclusive interview with 23andMe's Vice President of Genomic Health, Dr. Noura Abul-Husn, recorded live at the health conference in Las Vegas. Noura shares an impressive list of ways that genomic profiles can lead consumers to a more preventive state of health, including many that you might not be aware of yet. It's time to dive right in. Are you ready? Let's go. Flavor of the week. Let's connect the dots between the latest consumer research and the mission of what we talk about on this program, because it's easy to forget who the real competitor is in healthcare. First, what research am I referring to? YouGov's latest study on consumer perceptions of the U.S. healthcare system, including patient-doctor relationships. As my friend Sandra Brown from MDRG pointed out on LinkedIn, the newest data indicates a changing dynamic between physicians and patients. Patients are increasingly bringing their consumer mindset of choice and agency, and I would add expectations, into their healthcare experience. The days of being told by your doctor how to manage your health are going, almost gone. So yeah, there's a lot of data in this study to sink your teeth into, but the stat that I want to focus on is this. Are you listening up? 32% of Americans, including 23% of men and 40% of women, say they've avoided seeking out medical care as a result of negative experiences that they've had with a previous doctor. That's 1 in 3 of us, people. We can't ignore those numbers. We avoid care because of negative experience with doctors, and maybe it's helpful to remember that a little more often. When we talk about consumer experience, 95% of what we talk about has to do with either the business case for why to do it or the blueprint for how. And listen, we have to connect those dots. We know that. Nothing gets done otherwise. But that stat is sitting with me, and it reminded me about the realities of a society that, in increasing numbers, is choosing not to seek care at all for things that they really do need help with. Hopefully it's a good reminder that we don't want to accept that as the status quo. As an industry, it doesn't help when people avoid care. As a society, the ramifications are far more threatening. It's always fascinating to me to watch the status quo continue to beg for change not to happen. There are plenty of people who will always scoff at the very ideas of value-based care or membership-based primary care or health at home or food as medicine or digital health apps simply because they're different. They immediately think, well, that's different than what we used to have available, so it's probably going to fail. So knowing that a rather large number of people sometimes prefer to just exit the system rather than go find the next doctor in their directory leads me to 2 conclusions. 1, every conversation about the value of consumer experience should include how poor experiences are driving people to exit the system. And 2, innovative, preventive, upstream, health-based solutions and models are worth exploring, regardless of how loudly we hear the status quo telling us to just stick with incumbent sick care. Not only are these models evolving quickly and starting to take market share at the edges, but they might just be some of the ways that we become a healthier society. And that's what we're talking about, folks. Let's remember that stat, y'all. 32% of Americans avoid seeking medical care because of negative experiences with a doctor, and let's use it to fuel our innovative drive. That's another way that we'll build the healthcare of tomorrow, and that's the flavor of the week.
flow.
All right, so Jared Johnson, host of Healthcare App Podcast, and then I'm here with our guest.
Noura Abul-Husn, Vice President of Genomic Health at 23andMe.
Fantastic. So let's dive right in because I think the conversation is important to have these days about what digital engagement looks like in all of its forms. And I'd love to hear just what's that point of view, what's that perspective from 23andMe's standpoint? What are we talking about when we're saying somebody is engaging with their health and wellness?
Today, we're seeing a lot more from the consumer side in terms of how to engage with health and wellness. And where we come into the picture, 23andMe is offering genetic insights, and those are particularly meaningful when it comes to health and understanding your health roadmap, your journey for the rest of your life, what you might be at risk for, where you might have opportunities to optimize your health. So that does in and of itself create a way for consumers who are also patients in health systems to engage with their own genetic information, the most personal information that they could possibly get about themselves and how it makes sense of their health.
For the brand, so many people are familiar with, and they probably think they know the basics of, 23andMe, but what else is there that you find is helpful for people to know about just, what you even offer?
Yeah, 23andMe has been around for so many years. We started offering genetic tests, genetic insights since 2007. A lot of people know about 23andMe. Today, we have over 15 million customers, and that's growing every day. What's interesting is that people come into the experience for multiple reasons. And we're probably very well known for giving genetic insights that tell you about your ancestry, your ancestral origins, which is a really amazing way to find out, again, about your personal genetics and what that means for you. But more and more over the last 20 years in the field of genetics and genomics, we've come to learn that genetics plays an increasingly important role in every area of health and disease for every person in every context at every stage of life. And what that means is that by engaging with your genetics, you're going to learn information that pertains to your health. And that's something that we'd love more people to be aware of, that knowing about your genetics is going to inform your healthcare trajectory. And that knowledge, especially when you have it early on, before you ever need to seek medical attention because you're sick or you have a problem that you need help solving, that information that's bringing in your genetics can also help you stay healthy. And, today and here at this conference, we're hearing so much about longevity and people wanting to live longer lives. And it's really about making sure that you're living a healthy life for as long as possible. So what you want to do is have as much knowledge about your health status and your health information, your health risks and opportunities as early as possible to make the right choices that are going to keep you healthy for as long as possible.
I love that. So if I can play that back a little bit, that ability to understand at your personal level some more of the factors that impact your personal health and wellness. And then beyond that impacts some daily choices for those who are actively trying to pursue a higher level of health. It sounds like, did I capture that okay?
You did. You captured it really well. I would say everyone has a health trajectory, and I'm showing with my hands what that looks like. You have a curve and you're going to potentially a health condition at some point in your life. And as much as I love genetics, I'm a medical geneticist, I think about this all the time. It's not just about your genetics, though. It's a really key part of the story. But in addition to that, the way you live your life, your lifestyle choices, your environment, the food you eat, the exercise you do, the things like that we know impact our health, that influences your healthcare trajectory. And what we're getting better at is putting that information together and synthesizing it so that I can tell you what a trajectory looks like for you, but also can tell you what improvements you may want to make in your lifestyle, in the choices that you're making every day to impact that trajectory and avoid having a health consequence that's detrimental at some point in your life.
Okay, so that makes sense. That's got to be the foundation. Without that knowledge, you can't fully make those daily decisions that are actually fully informed with what is going to help you ultimately on an individualized level. So this brings up the notion that we've brought up a lot before on our show, which is just individualized health, which is the personalized nature of it and the necessity for some data and some technologies to be able to help facilitate a higher level of of that personalization, and doing that at scale where that's not sitting in the hands of me in a one-on-one encounter with my provider, where I can't expect them to even have that information without the right data and the right tools to be able to help them do that. And I'm just trying to help paint this picture of like what it takes. I think for a general healthcare consumer, which is every one of us, people just want to, they're like, I should have this information. I feel like there's more of a feeling of I should be able to know this about myself than there has been in years past. And I do think that speaks to the ability to find the right information about ourselves. And so I love that we're talking about like how to connect some of those dots for ourselves. What else is interesting to know, or what other insights have come up as 23andMe is just continuing to go down this road when it comes to helping people understand what to do with that data?
All big data and all of the newer types of data that are coming out, genetics can be complicated. And one of the key things is making sure that people understand that information. If you don't understand it, you can't use it to empower your health journey. So communicating genetic information in a way that makes sense to consumers has been key to having a direct-to-consumer genetic testing company. And more so, people are looking for next steps. Once I have my genetic health information, what do I do to optimize my health? What do I do to prevent disease? And who's going to help me in that journey? And this is, again, a way to really engage on a very personal level with your healthcare. And what we've done, for example, in our newest product called Total Health, we are offering this comprehensive enhanced genetic screen for many health conditions that are likely to impact a number of us in our lifetime because they're common conditions. And what we do is screen for those conditions, and then people who are engaging with Total Health get blood tests so that we know not only what your health roadmap is for the rest of your life, but where you are today. What is your health status today based on blood biomarkers, those labs that will tell me about your cardiometabolic health, for example. And then you need access to expertise. And today in traditional healthcare, as you just mentioned, there's a lack of expertise in how to bring all of that information together in a way that makes sense to clinicians, to consumers, to patients. And so we devised our own way to have a group of genetics experts who are bringing genetic thinking into clinical decision-making, providing clinical care services around this holistic product, because that was one way that we could think about really solving this problem that this type of care doesn't exist. And there's a barrier to getting access to the kind of information that's going to flip from that treatment-focused health system that we're very much used to this prevention-focused, comprehensive, individualized, personalized way of thinking about your health.
I love that, because I was going to ask about, who helps you do that? And you kind of answered that. You addressed that of, okay, great. Additional information that can be provided now that can help me on an individual basis. But if I don't know what to do with that, or if I don't know who's going to help, the term quarterbacking your health, is that I hear that a lot. Even for those who are actively engaged, sometimes we can get stuck. You mentioned that barrier, like you can get stuck on, I still don't know exactly what to do with this. So I just love this whole direction. I love the thought that this can be available now, that there's a way to not have to get stuck, not sure how to answer those questions. What else is helpful for consumers to know about, like if somebody's interested in that and in the Total Health offering and maybe they've tried other things that they're just not totally sure still of, maybe they have some history of disease in their family. I imagine people oftentimes will engage in a service like this, or even, some of the basic memberships with 23andMe, because there's some health outcome in their family history that is just either of interest or concern to them. Do you find that? What other ways are people engaging with services and data that you provide them?
That is a key reason that people might want to learn more about their genetic information, because they do have family history of cancer, or they might have even had something like a close friend, or have someone had a surprising health event in their life that made them more aware of what they could be potentially in for and are seeking that knowledge. And people are advocating more and more for their own health. We feel that type of knowledge is really empowering. And I think that's a great take-home message. Know more about yourself, know your family history, know your genetics, because that is empowering. And there are next steps that you can take to stay healthy. And it really does pertain to everyone. There's no one for which genetics isn't meaningful today. And that's really exciting because it's a future that is more promising when it comes to living that longer, healthier life. And what we are trying to do, and what I really think is key, is to have the consumer, the individual, be empowered to be an active participant in their own healthcare journey. And that doesn't mean that they're taking that journey on their own. They absolutely should have partners who are helping them and championing them and quarterbacking them, as you said. But you can't be as active a participant in your healthcare if you don't have the knowledge and the evidence behind what it is you should do next.
Couldn't agree more. Are there other aspects of bringing this directly to consumers? Do you find it different than trying to put that data in the provider's hands, for instance? Are there differences in how the data and information can be provided to somebody that makes a difference ultimately in how they end up using it?
There are some differences, but ultimately the information that we're giving to consumers about their genetic health risks and opportunities for prevention are not that distinct from what you do as a clinician in a healthcare system where you are thinking about risk factors, whether it's family history or lab tests or screening results that are putting people at higher risk. The difference is that in traditional healthcare, you do that in a way that is less individualized. For example, you really think about someone's sex and age and potentially some other factors to decide what kind of test they should be getting, different times, different frequencies. When you have added information on top of that, then you can really personalize that management strategy and think about when you would want to start screening. Is it earlier? Is it with different modalities, more frequent, and other factors like that are going to influence healthcare decision-making?
What excites you about all of this? I mean, just this whole general direction of, like, on a personal basis, why is this going to be so helpful, I guess, to people? What gets you excited about it?
What gets me excited is really the focus on prevention and the opportunity to leverage tools and science that have grown in remarkable ways in genetics and genomics over the last decade, over the last 20 years since we sequenced the first human genome. It's just been such a rapidly evolving space, and we're yet to catch up on the medical side in bringing all of this knowledge into how we think about human health and health prevention and longevity. And that's what's really exciting to me. And I hope that, a year from now, we're having a different conversation. We're seeing genetics much more broadly being accessed in routine healthcare because we have that knowledge and we're only going to get better at it.
Is that your prediction? I was going to ask, what you hope we would see more of. So more of those conversations happening.
Yeah, I would love to see more people engaging with their genetics, asking questions, being offered genetic testing as appropriate in traditional healthcare, seeking that knowledge on their own and feeling like they are that active participant in their own healthcare journey.
I love it. Any final thoughts? Anything we haven't mentioned yet?
We've mentioned so many things. I think the future is really exciting, and a lot of what has been talked about at Health these past few days is on this idea of living a healthy, long life and focusing on prevention. I feel like genetics really plays a key fundamental role in that. It's the basic building block of your health roadmap. And then we can layer on all of these exciting new other types of information from wearables, from biomarkers, and really build out that engagement over time.
Thanks so much for joining us. Really appreciate it.